Specialty Story, session number 121. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. My name is Dr. Ryan Gray, and I'm excited about our guest today. Now, if you're new to Specialty Stories, my goal here is to expose you to different medical specialties, potentially specialties you never knew existed. And our guest today is kind of unique, where she practices both oncology and palliative care. Our guest today is Dr. Wulff-Burchfield, and I'm excited to share her story. We start the conversation by finding out when Dr. Wulff-Burchfield first became interested in oncology and palliative care.
Where I went to medical school, we had a little bit of a different curriculum. And so we basically had 1 year in the classroom, 1 year in the hospital, 1 year doing research, and then the final year in the hospital again. Oh. But during our second year, we had these intersessions that were when we would all come together as one class and talk about specialties or fields that really spanned multiple disciplines. And so during one of them was oncology, because it really does encompass a lot of fields. It encompasses medical oncology, hematology, radiation oncology, surgery, et cetera. So during one of those intersessions, I just fell in love with what I was hearing about the relationships that these clinicians had with their patients, the way that they had these sort of intense relationships with patients that were really important to both parties. And while they were sad, they just were very meaningful over time and accomplished a lot together. And I really always thought of myself as somebody who was most skilled as a shepherd, shepherding patients and their loved ones through difficult and scary things. But I also knew that I was a really relationship-driven person. That was very clear to me. And even doing inpatient medicine, I would tend to get a little distressed because it's such a rotating door of quick relationships. And I knew I wanted something longer. So I really loved it I really just loved the idea of it. And then throughout my core rotations, while I enjoyed them to some extent, it became very clear throughout that year that I was meant to be an internist. And so it just felt like it really came together. So then during my third year, when I was in the lab, we all have a continuity clinic. So mine was one of the oncology fellows who I had known and really thought was a cool guy. And I'm so privileged to call him a colleague and a friend. He had worked with one of the internal medicine faculty who was also palliative care in his continuity clinic during his third year. And because he had sort of been at this medical school for his training. And so I worked with this physician. His name's James Tulsky, and he's a really well-known palliative care physician. And it was in his general medicine practice, but it had kind of a palliative care slant. And so I just thought the way he spoke to patients was incredible. I just thought, I've never seen anyone talk to a patient like this and really understand who they are and then make decisions based on who they are, not just what's possible. And so I just thought, okay, well, I'm going to try this on. I'm going to use this year as an opportunity to see if that feels like me. And it just really did. But I knew that oncology was going to be a part of my life. And so starting as a fourth year med student, I started exploring the possibility of doing both. And I met some other clinicians who did both, some of whom were actually trainees at this institution. And then everything just felt right. And I just carried forward with it. And throughout all my medicine rotations, in the hospital and in clinic as a resident, especially during my first year, I knew that while I had this interest, I wanted to try and force myself to stay open-minded. I'm someone has the habit of being very decisive very early, but nothing felt right. Nothing else felt right. wanted to like a lot of other things because I thought they might be less emotionally taxing. But in the end, nothing else ever felt as good as this idea. And now I will admit that now I'm doing this every day. I couldn't be happier. And if we won the lottery, I would do this for free.
That's awesome. That's one of the like testaments of a good job is like, what would you do for free that you could just do for the rest of your life and then find a way to get paid for it?
Exactly. Oh my gosh. I mean, I've promised my husband that I won't do it for free. And that seems like a fair end of the bargain, but I am really living my dream and much earlier in my career than I thought I would feel this way, to be honest.
That's awesome. So I want to rewind just a little bit to your medical school experience because I think that sounded super unique. And I'm just looking at your bio here, and you went to Duke. Is that a special program inside of the Duke curriculum that you did, or is everybody go through that same curriculum?
So at Duke, that is the curriculum. So they call it, quote, the new curriculum, which has been in place for decades. And I think that there are a number of schools, including where I'm on faculty now, that are doing something more akin to this now. Mm-hmm. But it wasn't anything special. That's just the only way you can go to medical school there. Now, if you do an MD PhD, then certainly what happens is you do classroom, core rotations, and then you do your PhD, and then you come back to the classroom for that fourth year, which is fairly similar to it's sort of similar to other MD PhD programs, I think. But nope, this is just how it comes.
Yeah, that's awesome. So I want to talk about something you mentioned about the heaviness of the field and something that you were wondering potentially early on if you could handle that. I think a lot of students potentially hear about oncology or palliative care and they think that's cool, but number one, I want to help people live, not help them die, and also just that weight, that emotional weight. How do you deal with that day in and day out?
Well, so I will say that my faculty position is 50% protected research time and then 50% clinical. And so I do think it would be harder for me personally if I had all clinical time, because then there's just because doing research, part of what's cool about doing research is that you get to try or hopefully do affect change on a greater level, which sort of takes you out of the boots on the ground, intense part of clinical medicine and oncology. The thing is this, I will say there are sad parts about my job, although I would challenge anyone who is a clinician in medicine to tell me that there are not sad parts of their job. I think that there absolutely are. My mother is a pulmonologist intensivist. There are difficult parts of her job. I have friends who are dermatologists and ENTs, and there are things that are devastating because the world is a broken place in some ways. So I think there are always sad things. For me, though, this is what I have to emphasize about the way that I think most people who would have a job like mine cope. It's not because we're martyrs. It's not because we're super strong or amazing or anything like that. It's because we are relationship driven. And for me, what I find is